Oxnard Hospital, in conjunction with Orleans and Jefferson parishes, are launching a COVID-19 prevalence study. They hope that it'll give a more accurate picture of the spread of the coronavirus in the two neighboring parishes. It'll be a groundbreaking study that'll target specific areas of both Orleans and Jefferson rather than simply random testing. Joining us via Skype right now is Dr. Leo Swanee, who is the Chief Academic Officer with Oxnard Health. Thank you for joining us, Doctor. And exactly how is this study going to work?
Thank you, Eric. Well, as you know, there are many more people that have been infected with the virus than actually seek care or have tested positive. So even though in Orleans and Jefferson there's been about 6,000 in each parish that have tested positive for COVID, we know that the actual people that have been infected are a lot more. So what we do with this study is to find out what that number really is we create a mini Orleans and a mini Jefferson Parish, and we represent all of the citizens in a much smaller number. So that's race, ethnicity, geographic location, age, and with that distribution of Jefferson and Orleans, we can test 2,500 people and understand what is the true prevalence, how far has it spread throughout our community, and which groups in particular. Are we seeing more in the Hispanic communities, the African American communities, which neighborhoods? And that can help our parish officials really, and our public health officials really kind of strategize and target how do we work to fight this virus.
And I assume the best way to describe this is when they do polling to see which candidate is doing what, they do in specific areas, targeted areas, not just a random survey. And this is kind of what you're doing here.
That's exactly right. We actually are using database from the census to understand the breakdowns of all of our neighborhoods throughout. And so I don't need to ask, like in a poll, ask the question of everybody in that neighborhood. But if I have a few in that neighborhood, they will represent the neighborhood.
And we're almost out of time, but this is a test that'll be more than just blood or swab. It'll be both. So up the nose and plus blood.
That's correct. So the antibody test will tell me anybody who had been infected in the past. And as you know, Eric, in March, there wasn't much testing going around. So there was a lot of people exposed that never got tested. And then the nasal pharyngeal swab will tell me if you're shedding virus and infected right now.
All right, Doctor, thank you very much. And this begins when?
It begins today, testnola.org. You can go on and register. I'm asking all the public in Orleans and Jefferson to register at testnola.org. And then you may or may not be selected based on you registering. But the more people register, and we're really looking for healthy people to register, the better the test, the study will be.
All right, thank you, Doctor. We appreciate that, and good luck on that.